Now I would like to invite Dr. Rekha Gupta. She will be speaking on food and drug interaction with the different diabetic drugs. What should physicians know? She is a senior dietitian, certified diabetic educator, and a registered pharmacist. Uh, she is MSc in nutrition and dietetics and certified pediatric nutritionist. She is having a keen interest in public education. And she has done many workshops on diabetic awareness and nutrition. And she is a member of American Association of Diabetic Educator. Over to you. Welcome, ma'am.
Thank you so much. Good afternoon, everyone. I am Rekha Gupta. I am a registered pharmacist, nutritionist, educator, and dietitian. So I thought this is a good topic to discuss. That is food and drug interaction with different diabetes drug. What should physician and of course educators, pharmacists, and dietitian know? I'm not going to go in a very detailed one-to-one thing, but this is just to tell you how we can go about it and why we should think of drug and food when we are addressing a patient. How can somebody help me with the slides, please? Okay, maybe from here. Okay, so medication can help people live healthy, we all know, and prolonged period, they can live for prolonged period. Although medicines are prescribed often, it is important to realize they must still be used with caution. Some foods, even healthy ones, can make your medication less effective if you don't take them properly. For physician, knowing food and drug interaction is vital for ensuring patient safety, optimizing treatment, efficacy, and to prevent complications. So, understanding food and drug interaction is essential for physicians for several reasons. First is patient safety. Physicians need to ensure the safety of their patient by prescribing medication that do not interact adversely with specific food, which we generally ignore. Second is optimizing treatment efficacy. That means knowledge of food and drug interaction allows physician to optimize the efficacy of the prescribed medication. Third, prevention of complication. Food and drug interaction can lead to complications such as gastrointestinal upset, changes in blood pressure or blood glucose level, or even life-threatening reactions. So they should be aware about it. Patient education is also very, very important. So physicians play a crucial role in educating patient about potential food and drug interaction. And then if we know all this, we can do a individualized treatment plan. Overall, understanding food and drug interaction is fundamental in providing safe, effective, and patient-centered care. There are many kind of interactions. So we have food-drug interaction, we have drug-nutrient interaction, we have drug-drug interactions, we have disease-drug interaction. There are many, many kind of interactions. So food-drug interaction, we know that food interacts with the drug. The drug and nutrient is when the drug affects the nutrient. And then we have drug-drug interaction, which are commonly used. I will mainly be focusing on food and drug interactions. Drug interaction can be caused by prescription or over-the-counter drugs like vitamins, herbal products, foods, disease, and genetic. The incidence of drug interaction is known because many are not reported. Many are not reported, and when they are reported also, we use it, we don't know if it is a food-drug interaction. We take it as a adverse reaction. We think that we had given this medicine and there are some side effects of the medication. So the interaction part comes very late in our minds. So this is one thing we should be aware of. When a patient is diagnosed with diabetes, a large number of medications are given to them, and they include medication for dyslipidemia, hypertension, antiplatelet therapy, glycemic control. So many medication can be very overwhelming for the patient, and he doesn't know what to do, when to take, and he is always very bothered, said drug and drug, कहीं ये दवाई दवाई से तो इंटरेक्ट नहीं करेगा, ऐसा तो नहीं है कि मैं कुछ खाऊं उससे इंटरेक्ट नहीं करेगा. Most of the patient don't know the time of taking the drug. So these are certain things which a physician has to educate them about. So clinically, drug interaction pose potential harm to the patient, and they may result from changes in pharmaceutical, pharmacokinetic, and pharmacodynamic interactions. So what are in order to understand food and drug interaction, it is important to understand how drugs work in the body. There are 4 stages we all know: ADME, absorption, distribution, then metabolism of the drug, and then the excretion. Absorption, distribution, metabolism, and excretion. So this is how it works, the drug interaction. In the left, potential mechanism of drug interaction, left is specific ADME, absorption, distribution, metabolism, and excretion of drugs, which may cause increase in the plasma level of and toxicity. Right is the change in the receptor affinity and synergistic effect, matlab और बढ़ा देना, synergistic effect of co-medication that can increase the clinical or even toxic effect even at the plasma level or remain unchanged. So what are the risk factors of drug and food interaction? It can be many, like age, gender, medical history, body composition, nutritional status, number of medication used, nutritional supplements, special diets, tube feeding, herbal products, alcohol intake, polypharmacy, drug of abuse, non-nutrient in food, XCP in drug and food. Patient at risk of food nutrient interaction, I told you it can be fetus, it can be elderly, it can be pregnant woman, it can be malnourished patient, allergies and intolerance. So these are the basic diabetic drugs we generally use: metformin, sulfonylurea, insulin, DTP4 inhibitors, SGLT2. These drugs are basically, so I'll be talking a little about them with the food. For example, the hypoglycemic effect of glyphosate or sulfonylurea may be delayed slightly if taken with a meal versus 30 to 60 minutes before the meal. So what happens? HbA1c will remain same, but what will happen? That the sugar levels will not come down as much. For example, vitamin K intake from green leafy vegetables interact with warfarin, and similarly, several medication may complex or chelate with co-administered medication, significantly reducing their absorption in the blood. So drug-food interaction, several reports have been observed. Their effects of herbal medicine and plant foods on drug bioavailability. Drug-food interaction can result in 2 main clinical effects. Either they decrease the bioavailability of the drug and result in the treatment failure, or they increase the bioavailability, moreover increases in the risk of adverse events. Drug-food interaction show that the selection or the choice of drug in diabetic patient may affect the presence of food, so that the therapeutic efficacy of any drug may alter because of the drug-food interaction. So foods can interfere at any stage of drug action in number of ways. They can affect in drug absorption stage, or they can affect at the excretion stage, or they can affect on the distribution stage. So many, we have to see at what stage the food and drug are interacting. So these are some common food-drug interaction. For example, we know grapefruit generally interacts with most of the medications. So grapefruit contains a compound called furanocoumarins that can inhibit the activity of enzymes in the liver, particularly cytochrome P450 enzymes, and these enzymes play crucial role in metabolism of various medication, including some diabetic medicine. As a result, consuming grapefruit or grapefruit juice can lead to increased level of certain foods, drugs in bloodstream, potentially causing adverse effects. Alcohol and diabetes is also very, very discussed topic. So if you are consuming alcohol in excessive amount and not eating, so you can, what will happen? You can go in hypoglycemia. So when a patient comes to you, generally, first thing I ask him, ki, do you have alcohol? And if yes, then how much? And I tell him the proper way of having alcohol. Because I had a patient who said I was diabetic and my sugar is controlled, but now I have a liver failure. I said, how? He said, they said, don't eat chini, aloo and chawal, but they didn't tell me not to have alcohol. So I started having egg pav of alcohol every day. So now he is into liver cirrhosis. So you have to tell them ki, if you are having alcohol also, then how to consume and what kind of snacks you should be taking. Otherwise, he can go into very bad kind of hypoglycemia. Then high carbohydrate meals. Of course, if you are having high carbohydrate meals and giving the same insulin or same drug, then his sugar levels will increase. So you have to teach them about that also. So these are some drug-drug interactions. Statins, which are given for lowering the blood cholesterol in cardiovascular disease. They can be interact with certain diabetic medications. This inhibition can lead to increase in insulin resistance, impair glucose metabolism, potentially worsening the glycemic control. Then we have hypertensives. Certain class of hypertensive medications such as beta blockers or thiazide diuretics may affect blood sugar levels and interact with the diabetic medication. Beta blockers can mask the symptoms of hypoglycemia. The patient will not know that is in hypoglycemia, and then he will go into very low blood sugar levels. Thiazide diuretics can increase blood glucose level and may necessitate adjustment of diabetic medications. So what are the strategies of minimizing? There has to be a comprehensive medication review with the diabetes educator, the doctor, the dietitian. For example, a patient with diabetes may prescribe metformin for glycemic control. However, if they are not taking the medication like trimethoprim sulfamethoxazole for a urinary tract infection, it can cause the risk of lactic acidosis due to metformin accumulation. By reviewing all medication, physicians can proactively identify and manage the potential drug interactions. Then it is very important to do patient education, and it should be done regularly, and ask them and tell them about the food and the drug which they are taking and how they can interact with each other. And then we can have a individualized treatment plan. We should take diabetes history, and then we should know what all medications are he is taking, and then plan his and tell him, if you do this, most of the patients who are on sulfonylureas, they don't take the medication 30 minutes before the meal. They just eat and start. So the food generally doesn't let the sulfonylureas work as well as it should be working. And then SGLT2 inhibitors, we give metformin and SGLT2 inhibitor to reduce cardiovascular risk, while the later may require adjustment in medication dosage to account for impaired renal function. And regular monitoring and follow-up, monitor patients regularly for signs and adverse drug reactions, changes in glycemic control, and potential drug interactions. So this is, I have given some case studies. This background, a 65-year-old male patient with type 2 diabetes presents with clinic with symptoms of urinary tract infection and has been taking metformin 1000 milligram twice daily for glycemic control. The physician prescribes him this medicine, trimethoprim sulfamethoxazole, and the analysis is that Trimethoprim sulfamethoxazole is known to inhibit the renal tubular secretion of metformin. So what happens? The metformin serum levels increase and he can go in lactic acidosis. So management is that the physician should talk to him what medication he is taking, and then he can adjust the dosage. And then we have same that a lady, 50-year-old lady is admitted with the symptom of confusion, sweating at palpitation, and we came to know that she was taking wine in some dinner, and then she went into she went into hypoglycemia, and then it had to be managed. So she has to be taught to take wine in prescribed dose. Then we have a patient who was atorvastatin for cholesterol control. He had weakness and dizziness, and then the analysis was that statins can increase the risk of myopathy and rhabdomyolysis, which combines certain diabetic medicines like sulfonylureas, which are associated with muscle-related side effects. So management is the patient healthcare provider discontinues sulfonylurea medications and monitor him closely for the resolution of symptoms, and he can be given some other medications like DTP4 and GLP-1 receptor agonist. So this is one thing I would like to say, that most of the patient when they come to the physician, they don't tell them that they are taking herbal medications. Most of them are taking methi, most of them are taking some paneer ka phool, most of them are taking karela, most of them are taking some herbal thing. They are taking jamun ka beej, karela ka beej, they are taking some kind of herbal medication which they never tell the physician unless you ask them personally. These all have hypoglycemia effects or some other kind of effect, and then it synergizes the effect. So they can go and go. So please be aware, when a patient comes, please ask him, tell him everything from morning what you eat and drink till night what you eat and drink, and tell me if any kind of herbal thing you are taking, because this has led to many problems. So these are, I've just made, this is jamun, karela, and then we have garlic. These are different herbs jinka mechanism and what anti-diabetic effect they have. So I can't go through this. Metformin, we all know that it reduces the B12. So once a patient is on metformin, please get his vitamin B12 checked. And benefit of minimizing food and drug. This is the last slide. Medication achieve their intended effects, improve compliance and with medication, less need of additional medication or higher dosage, fewer caloric or nutrient supplements are required, adverse effects are avoided, optimal accidents and injuries are avoided, disease complications are minimized, the cost of healthcare services is reduced, there is less professional liability. So my key home take message is that it is not going. Is food and drug interaction are significantly impact the effectiveness and safety of diabetes medication. So it is very necessary when the patient comes to your clinic, please talk to him and see that what kind of food and medication he is taking before prescribing the medication. This is very, and then we can do the individualized plan. So thank you so much. These were my key home messages, that please take this into consideration before you are prescribing, or if a patient comes to you with some kind of effect, please ask him about the food and drug and can go through a food drug interaction which might be happening in his therapy or something. Thank you so much.
Thank you so much. Thank you.